That's perfect. That's great. That's the right size. That's lovely. Thank you. Yes, I understand that meeting hasn't been held for a while. Obviously, we are looking at having this meeting and the next meeting virtually. And then hopefully we can set a date in September where we can actually have a real life meeting in a venue, so people can actually get together, which I'm sure will be a joy after all this time of looking at screens. So I'm hoping that our first speaker, who is Dr. Natalie Smith, is with us.
Yes, I am.
Yes, you are. That's right. Okay, so Dr. Natalie Smith, I'm going to hand over and she's going to talk to you.
Hello everyone, and firstly just a big thanks to the organisers for accommodating a slight change in the agenda just so that I could have 5 minutes slightly earlier than planned. That's because I've got my 2-year-old with me today who won't be kept quiet for long, so I'm going to have to dash off in a bit, but so apologies and thanks in advance for that. So firstly, I'm really conscious that I recognise a lot of faces from the meeting that was held last Thursday afternoon for the Alton Community Coordination Group, but I think not everyone. So is it worth me doing just a brief update on where we are with the COVID vaccination programme? Is that what everyone's hoping for? Brilliant. So I shall do that and not take up too much of your time. So as you know, we've, as a group of 4 GP practices in the Alton area, together with the other 11 practices in North Hampshire, so a group of 15 practices across 6 primary care networks. We've been running our primary care-led vaccination programme out of the Hampshire Court Hotel, which started vaccinating on the 16th of December. And so far, up to literally minutes ago, we've done about 54,000 vaccines at the Hampshire Court Hotel, which is a fantastic effort that's been recognised by Matt Hancock and the national system as being one of the best performing primary care centres in the country. So it's running really well. And I think anyone and any of you that have been there will recognise it as being a very kind of safe and efficient and well-run site. So we're very pleased with how that is going, obviously. Alongside that, there's obviously the national vaccine programme, which is running at the Basingstoke Fire Station, Superdrug in Basingstoke, and soon to be opened, as I'm sure you're all aware, the Alton Pharmacy, Boots Pharmacy on the High Street in Alton, which should be opening this weekend, I understand. So from a local perspective, of those 54,000 patients that I've just mentioned, we've vaccinated 13,000 patients from the A31, and another about 350 have received their second doses. That's a relatively small number at the moment because second dose is only starting happening as of, in fact, this Friday, the 19th, we're starting the second doses in earnest, and then we've got a couple of slow weeks, and then from the week of the 29th, lots and lots more second doses will be happening. Now, from the point of view, again, of the local area, if you've had your first dose, in theory, across the system, you're supposed to go back to the original venue where you've had your first dose. And certainly most of these first doses will have been Pfizer, which has to happen in the big centre. So most people will be invited back to the hotel for their second doses. In terms of how we're covering I'm sure you're all aware of the JCVI cohorts of the kind of the most vulnerable and most at risk patients. So we've got very good coverage across those. I won't go into the detail, but for the cohorts 1 to 4, we're at over 94% for all of those areas. And then below that, we're still pushing through vaccine, the cohorts 6, 7, 8, and 9, and are due to have given first doses to all of those beyond the target, well sooner than the government target of the middle of April. As I said, second doses will be starting on Friday. We are very conscious that not everyone can get to the Hampshire Court Hotel in Basingstoke, and I'm sure you're all aware that there have been either services available to help people to get to Basingstoke or to provide vaccine locally, either within the surgeries or within patients' own homes. And that vaccine that's been given there has obviously had to be the AstraZeneca one. I think aside from that, with the vaccine programme, unless anyone's got any questions about it, those are the main things that I wanted to cover off with that. The only other little bit to say on that is that there's planning ongoing at the moment in terms of expanding out to cohorts 10 to 12. So that's anyone under the age of 50. And there's decisions ongoing at the moment as to whether we continue down to that cohort, but it's looking very likely that we will. So there'll be more on that as soon as that is opened up. So that's the kind of the very latest on that. I was also asked to provide a little bit of a kind of update, I think, on post-COVID and well-being and health kind of going forwards. I have to hold my hand up and say that our plans for that are not a kind of very well formed and an official something I can sort of talk you through at the moment, other than, and that's partly because focus has been very much on the vaccine programme for a little while, understandably. But other than to say that we are thinking about kind of coming out of the other side of COVID and how we kind of take things forward from here. And there's hoping to be very much a focus on kind of keeping people well, avoiding admissions to hospital, avoiding people becoming on, and focuses within that on mental health, healthy weight and healthy eating, all of the kind of things that I know this wonderful group is very good at kind of looking at and taking forwards. So I think we're very keen to continue to work with you and to share kind of the plans that we have and hear what you're doing. I think, did I see our social prescribers, Laura and Sylvia are on here as well, and we're going to be working with them and with other areas to try and to form a good plan that we can all have going forward. So as I said, nothing kind of specific and concrete at the moment, but that is very much going to be our focus, as well as looking after people with long-term conditions as well as we always do. So I hope that's helpful, and I'm happy to answer any specific questions if there are any.
I just have one. I've heard several people are having long COVID problems. Have you come across many?
So, and long COVID is a kind of a vast kind of area that encompasses all sorts of things, and some people are suffering from multiple symptoms within the long COVID bracket, and others are, it's one specific thing. Particularly fatigue is very common, things like that. So it's a big area. It is a very much acknowledged thing, long COVID, and there's a service running through the hospital in terms of supporting people with that. So yes, I'm aware of it. It's not exceptionally common, but it is certainly there, and it's something that we're aware of and are helping to support. It's also possible in children, so there's a service that is being made available for children with long COVID as well, sadly. So yeah, it's out there and it's horrible. So we're very much aware of that, and the fact that needs support, and often months after someone's actually had COVID, they're still suffering, and we don't want people to be lost from our radar from that. So
no, thanks, Natalie.
Thanks very much. That was really, really interesting, and it was good of you to do that. Thank you very much indeed. No. I'm now going to hand over to Councillor Pam Jones, who's going to give an update herself.
Well, I've scribbled something down, and I will send it in to you if you want to stick it in the minutes later, if you don't want to take notes. I mean, basically, during lockdown, Town Council continued to meet regularly via the dreaded Zoom, and we didn't cancel any meetings, believe it or not. We continued to make progress on various projects, and I'll list them. Basically, these health and wellbeing meetings kick-started the council into producing its own health and wellbeing strategy. That has finally been rubber stamped by the council with one or two minor tweaks, and that will be on. There'll be a link to that on the town council website fairly soon. I will send that link, which can then be sent round to everybody, because there's a lot of good stuff in there. We've carried on supporting the King's Arms, who have gone in the final stages at the tannery, which I believe is now open. We haven't had the grand opening yet, but that also started through these meetings, which is another star for this group. Someone mentioned earlier the open spaces. We've continued as a council to maintain the open spaces, and they have proved invaluable at this time for people to be able to get out and about in the fresh air, safely distancing, And we've also included the open air seating in the market square and at the assembly rooms, which allowed people to pick up a cup of coffee from a takeaway and go and sit somewhere in the open air and drink it. We've continued to be part of the Alton Community Coordination Group, where we meet with local organisations to ensure the community are supported in a variety of ways. We started publishing a weekly Altonian, which originally was in hard copy and at the supermarkets, but now it's online, it's available through the Town Council website, and it gives lots of up-to-date information on all sorts of things. And it's included the vaccination progress, it's included links for people who've got mental health issues, and when you can go to the tip, all sorts of, and we feel that's been a very useful thing for people to have. COVID signage was installed in the town very early on, to aid the lockdown, and we've continued with meetings with the district council and the county council, looking at ways to revive the high street, because obviously lots of shops have been closed and people are struggling really, but that is ongoing. We're continuing with talks about the station forecourt, what's happening at the brewery site. So all this has been happening behind the scenes. And finally, can I just say, Christmas wasn't cancelled, but instead of one big Yuletide weekend, we had several smaller markets throughout December. That's allowed a lot of charities to have stalls to raise much needed funds, because they've been hit badly this year. We had a new marmot called Mirabelle, who kept Marmite company, and there was a marmot trail for people to follow around the town. And thanks to the dynamic duo, Luke and Elliot, we had a series of shop local videos produced promoting the high street. And this wonderful duo, who are local lads, I have to say, I've known Luke since he was 6, a local duo carried out the Christmas lights switch on. Moving forward, we have plans, of course, for some more themed markets and a walking festival of some kind. But all these things are in a state of flux. You have to keep looking carefully. We're also looking at ways our open spaces can be used, because we don't want them abused. There's been a lot of problems with litter this year, antisocial behaviour and various other things like that. But it is a positive spin, I think, that we've kept going all through this year with a lot of support from lots of people. Thank you. I'll take questions if anybody's got any.
Can't see, I'm just going through the chat and I can't see any questions in the chat. If anyone's got any. Well, thank you very much.
That's all right, they know where I am if they want to say anything.
Thanks very much indeed. I'm just going to give now a brief update on Community First. As I said, my name's Jackie Hartless, and I'm the Health and Wellbeing Manager at Community First. It's been quite a busy year in different ways, I think. Like everybody, the lockdown has affected a lot of what we do. We have been taking referrals from the Hampshire County support headline during lockdown, and we have our own helpline where we are helping people to access any support that they need, whether it's basic food shopping, collecting prescriptions was quite a big thing, but it's sometimes where people are struggling with the lack of social contact. So maybe they want befriending schemes, or maybe we can refer them to local groups that can actually give them the help and support that they need. So that's taken quite a lot of time and work to I suppose get that running smoothly. We're looking at helping people transition now from lockdown and from that isolation back into a recovery. In certain areas we have a wellbeing worker who is working with individuals to help them on that journey. We have our community transport Dial-a-ride and Call and Go will be restarting, but we have also been providing transport for people to medical appointments and to access the vaccine. And although I understand Howell is I believe on here as well today, he can maybe update you slightly more on the transport, but we will be getting our services up and running, and hopefully we have all our passengers waiting to leave on the bus and get back into the high streets and supporting the local shops. So we last end of March last year, Community First merged with another CVS covering the whole of the New Forest. So it was a difficult time to have that merger, but we are now fully integrated with myself. I worked with the CVS in the New Forest, so I've now taken on the role of the Health and Wellbeing Manager, and we're looking at to meet the needs of the local communities that Community First currently covers. I think going forward, it would be a really good thing for this partnership to certainly meet face to face, but possibly have a couple of meetings online, because they are shorter and very often people can actually manage to make those, whereas to go and meet face to face is a much longer sort of time commitment. So I think going forward it'd be really good to have maybe 1 or 2 online meetings and another 2 that are face to face, where people can actually get together and maybe stay and network afterwards, that sort of thing. So that would be my view to going forward. But obviously this is a partnership forum, so it's very much about what people want from it, what people want subjects people want covered, and so we're welcoming anyone's ideas going forward. So that's all I'm going to say. We now are going to have a video about the community larder, the community food larder in Alton, and we've now got the video up.
Hi, I'm Sandy, and I'm the co-founder of Alton Community Cupboard. The Alton Community Cupboard started in December 2018, just over a year ago. The main purpose is to prevent food going to landfill. Every morning, our little team runs around Alton collecting all the food, brings it back into the cupboard where we have loads of tables and fridges and things, and we sort it all out, make sure it's all safe for people to eat. And then we package it up in a pre-ordered package for people. It's almost like a takeaway, except it's all made of food that would have been destined to landfill. We place a lot of food outside so that passersby can help themselves to as much as they want. We have flowers, bread, usually fruit and vegetables. And at the end of the day, if there's anything left that's no longer fit for people, we take it to a farm so the animals can eat it. Currently, we have about 20 volunteers. We've got quite a big team. We need at least 2 people every day that are packing the food and sorting it out and serving customers. And we need lots of people to run around and collect food, and also people to run around and deliver food, because we deliver to people who are shielding or isolating and can't come to us. The Alton Community Cupboard is open every day except Thursday and Sunday. Usually we open our doors from about 11:30, sometimes a bit earlier if we're ready, and we close at 1 o'clock. We're based in Westbrook Walk. We have a lovely little shop in the pedestrianized area of Alton that's been donated to us from the owners of Westbrook Walk. It's a nice central location, easy to get to, and you'll find us there just about every day. Because of the pandemic and the economic fallout of the pandemic, we do have a lot more people that are starting to rely on us now. It's a nice supplement. A lot of our people are getting assistance from other agencies, but it's nice to have the free fruit and veg, and it's free to everyone. Volunteers are running this project because we have always been upset about the amount of food that goes to landfill and the fact that there's also people going hungry, and both of those things shouldn't happen. We're all quite committed to both feeding people and saving the environment. Fortunately, we found a way that works to do both. Initially, when we opened the cupboard, we did it like a little shop where people could come in and shop as you would anywhere else, except there was no till. No one had to pay for anything. When COVID started, we completely shut down and went to delivery only. So our usual customers that we knew about, we asked for their details and went and dropped the food off to them. And now we kind of have a mixture where we prefer people to come to us, obviously, and collect the food, but some of them that are unable to leave their houses, we still continue to deliver to them. We get donations from most of the local grocery stores, including Aldi, Tesco, Waitrose, and M&S. And then we get a couple donations once a week from farther away shops such as Asda, Basingstoke, and Costco. We also get donations from local allotments and people that grow their own fruit and vegetables. And occasionally people bring us extra tins and packets as well if they've changed what they eat or they have extras. So it's quite a community project. The whole project is down to donations of time from our volunteers, of food from the shops, of the premises from the landlord. All our furniture is donated, all our displays are donated. So the people of Alton have really come together to make this project work. I think everybody needs to be aware of how much food waste is out there and how much food need is out there. And it really isn't that difficult to set up a project. We'd be happy to help if anyone wants to do a project in their area and give it a go.
Well, that was nice and positive, I think, and it's really, I think it's something that is obviously working really well, and it's been really helpful and supportive for people during this period. And it is nice to see something really positive that's, you know, come out of a very bad situation. So that was great. I'm now going to hand over to Jess Berry, who's the Senior Commissioning Manager for Northants CCG.
Thank
Jess.
you. Thanks. Afternoon, everyone. It's good to see so many on the call. I think I counted, yeah, it was 36 earlier, so that's excellent. And hopefully we can all see face to face in the coming months. So just wanted to touch on physical activity, really. We've had a few workshops about this at the partnership. So in terms of life after COVID, there is some evidence to suggest that people's healthier lifestyles have taken a turn for the worse. People are eating more, you work at home, you're in that snack cupboard, you're also exercising less, there's less planned activities and people having to self-motivate to go out on their own. So we do forecast that there will be a rise in some physical health conditions such as diabetes and obesity. So just wanted to start by getting a feeling for, do people, hands up if they think their physical activity has declined in the last year? Yeah, quite a few. And increased?
Declined but increased recently.
Good. Okay, so mixed bag. So this is one of the areas that I think this group is really good at, and I know Pam mentioned some initiatives that she's already thinking about. So that's really good, and we can build on those ideas as we have our next partnership meeting. Does anyone remember how many minutes of moderate exercise you should be doing a week? Sarah, how many was that?
Is it 20 a day, 150 a week?
It's 150 a week. Very good. How many minutes if you're doing vigorous intensive exercise?
Ooh, I don't do vigorous intensive exercise.
Me neither.
Half of that.
I
75.
defer to Dr. Bethel on this one. I'm sure you'll know the answer.
I had a Fitbit for Christmas.
Brilliant. So yes, it is. It's 75. So if you've not got too much time on your hands, you need to raise that heartbeat pretty hard. What I'll do is I'll send out the infographic that comes from Public Health in terms of what sort of exercises you can be doing and what illnesses that they prevent. I just wanted to take an opportunity really to catch up on where we got to before COVID. And Hugh, who I think is on the call, yes, you produced a directory. Have you got any updates on that?
Yes, I can tell you about that. We did indeed produce a directory. We're due to launch it last April, so that went well. And we have created a listing of all the exercise opportunities in and around Alton and all of the clubs. And of course, that's now out of date and not too useful, I'm afraid, because if they are open, you can't go to them. The full listing has now been published, though, on the Alton Town Council website. It is very good, but unfortunately, it may need a lot of modification and changing once once we reach June, I suppose, and clubs and exercise facilities are open again.
Yeah.
And can I add one other thing, and that is that the minimum amount of exercise recommended by the government of 150 minutes a week of moderate or 75 minutes of vigorous exercise is a minimum. And they do say that if you can double that, you're probably getting nearer what you need for really healthy living.
Yeah, ideally, yeah, you should have physical activity as part of your daily lifestyle. So I totally agree there, Hugh. So I think that's something to take forward in terms of towards June as restrictions are lifted, that we can review that directory to see if all those clubs are coming back online, because that would be really useful resource to the community.
As a fact to say, we do have an active committee that will be working on that, and we will be updating it all and producing a hard copy and circulating all the residents of the GU34 area through the Altonian.
Brilliant, thanks Hugh. So any other updates of stuff that will be coming online once restrictions are eased is we have Alton Sports Centre they did it last year, relaunching their mental health exercise and education programme. So that's a 12-week programme of various activities at the sports centre, but also some education as well. So we're speaking with them about relaunching that once we can. So we'll let you know the details on that. Also, just to know that there is opportunities for people with mental health in Basingstoke if they can travel as well, at the Basingstoke Sports Centre and at the Leisure Park Aquadrome. I think that's all I had, unless anyone else has got any updates on physical activity or things that are on your mind or things. Oh, Sarah's got her hand up.
Thanks, Jess. Yes, just wanted to sort of make it widely aware that we've obviously not had cardiac rehab going on for new referrals for the past year, because when people have come out of hospital having had some kind of an instant and a cardiac event, they've had only telephone support from the NHS, which then normally lead on to face-to-face to exercise at the cardiac rehab centre. But because there's been telephone support and we've not been able to take new referrals because we've not been able to get up close and personal to do assessments and that sort of thing, we've had a cohort of people for the past year who may be out there in the community that social prescribers might come across, or you might know of people who've had some kind of incident and they haven't had any face-to-face rehab at all. They've only just had telephone support. Now that might have been okay for them. Possibly they've been fine with that. And we made some films with the NHS team in the early days of the lockdown last year, so that people who were at home could have something to watch and follow. but we're quite concerned that there's a large number of people out there who probably could do with some face-to-face support. And so from April the 12th, when all being well, we're reopening again, we are very much open for business. And so we would very much like to hear from people who want to refer themselves or come via their GP. We are talking to the Primary Care Network via Natalie about that, to be able to possibly ask GPs to write to their patients who have had that happen to them, to recommend that they visit us and have a chat. So, but if there's anybody on this call who knows of anybody or has any routes out there to people who might find this important for them, then please do get in touch. And secondly, we're also doing a little bit more training for our staff on pulmonary rehabilitation, just with the long COVID rehab being borne in mind. Obviously, there's long COVID is complex and there's many different things that could be need to be treated. But if there's something that exercise can help with, then we're in also a good place to be able to help with that.
Thanks, Sarah. I'm so pleased and hope we do open again on 12th of April. Hugh's got his hand up.
Sorry, I'm sorry to keep on.
No, that's fine, Hugh.
Just two things to add. One is that I'm pleased to say that Basingstoke Hospital, the North Hampshire Hospital, is now becoming much more involved in the idea of exercise being good treatment for their customers. They've got a moving medicine department headed up by a lady called McKinnon, and they are also embarking on a long COVID or post-COVID rehabilitation program, and I am in discussion with them about that. And I do anticipate that we will, at the Cardiac Rehabilitation Centre, be offering exercise programs. And that will be helpful because one of the most serious or most debilitating problems after COVID can be lack of physical fitness, inability to get going due to either inactivity over the period of their illness, or perhaps in some cases due to heart or lung damage after the recovery from the acute infection.
Yeah, that's a good point, Hugh. Did I see another hand? Oh, sorry, my internet's unstable, so I'm not sure if people can hear me. Yeah, Ross from East Hampshire.
Hi, Jess, everyone. Just to mention, we've been doing stuff as part of our partnership with Hampshire FA, and now recently with Hampshire Cricket Board. With Hampshire FA, we've done a series of Twitter events engaging a range of football clubs about conversations about dealing with sort of COVID-19 and the situation, and also with our ambassadors and finding out what are the issues for some of the clubs. And we've basically had quite a few reports about people, some people coming on those talking about nervousness about returning to sport. And as a result of that, I've had a word with Penny at Energise Me and have just finished this morning preparing a Small Sport England bid to have a look at doing some of the work that we're doing there. But we have been providing some ongoing support through our ambassadors and providing sort of additional information and support through those ones, and that's through some work funded through East Hants District Council as well. So all good, and there's more sort of online engagement to come going forward. So is that really?
And does that work span your patch, and is it in Alton?
Yes, it is in Alton. Yeah, we with Alton Cricket Club has just signed up to our ambassadors program, and they're starting to put some information out there to across the. I think we just finished very recently training up, I think it was 6 ambassadors in their club to help and reach out across Alton and raise awareness and so on. So yeah, right across the patch.
Brilliant, thanks, Ross.
What we can do, if anyone's got any further questions for Jess, if you want to add them into the chat, and then if we've got some time at the end, we can then, present those questions to individuals. Is that okay?
Yeah, thank you.
Thanks ever so much. Now I'm going to go over to Jamie from East Hampshire District Council.
Hello everybody, hope you can hear me okay. I just thought in order to underpin all of this wonderful community activity that's going on across Alton and surrounding villages, that it would be helpful to just remind you of some grant funding sources that are available, because goodness knows we know that local groups and organisations could really benefit from it. So date for your diaries is the 1st of April, when the District Council's councillor grant schemes open, and that is for grants up to £1,000 from your local ward councillor. In previous years, we've supported a number of health-related issues such as defibrillators, support with people's mental health. So just to flag up that opportunity is there. Secondly, again, launching again on the 1st of April is the council's main funding stream, which is the Supporting Communities Fund. I will put more details within the minutes about how you can access this information online, but just to say that there are 3 key priorities that Councillor Julie Butler's very keen to look at, which is supporting positive mental health in residents, and particularly in young people. And again, that links very closely to what we've been saying about COVID. It's also for projects looking at social isolation in residents, in particular older people, and how we can reduce social isolation and loneliness. And what wraps it all together is that general supporting the recovery of residents from the coronavirus pandemic. So things that we would look at that may help entice people back out. So linking with what Jess was saying about fitness opportunities, but also about befriending opportunities and things like that. So I think it's a really good opportunity to maybe say, what is it that we've identified we need within this area, and how can we put together a bid to support that? Finally, some of you may be aware that the council published its welfare and wellbeing strategy in August last year. That runs up until 2024, and that really guides how the council wishes to improve the health and wellbeing of its local residents, all the way across East Hampshire, but especially focusing on those who may be a little bit more vulnerable or who may be at risk of poorer health and wellbeing outcomes. Now, importantly, connected to that strategy is a large fund of £715,000, no less. Don't even know if there's any pennies on the end. But the council is currently finalising that process of how those funds will be awarded. But certainly that is a really, really exciting opportunity when we recognise that a lot of our neighbouring boroughs and district councils are reducing the funds available to the community and voluntary sector. We're actually making funds available. So I think it's about getting that word out there and looking at how we can utilise it fully. I think that's all from me. I haven't seen the agenda, Jackie, but I was just going to say, do we have a slot at the end for asking people about what they might want to look at next time round and the shape that these meetings could go with?
Yeah, we have got some time, and as I say, if anyone has questions they want to ask anybody, then if they put them in the chat, we've had some flexibility on the time, so we can actually take any questions if people have them now.
I've got one for Janie, actually. Janie,
Hello, Pam.
I'm going to send a link out. We're going to send a link for our health and wellbeing strategy.
That would be
Is there
brilliant.
a possibility you could do it for yours?
Certainly. I was going to suggest...
Save us dipping into another website looking for stuff. If you send the link, it makes life a lot simpler.
Yeah, what I was going to do is send the funding information links to Lynn because I understand she's doing a sterling job in circulating that. And I'll also put in there a link to the strategy, so if we can also support it with yours. How long is your strategy for, Pam?
Oh, golly, now you're asking me off the top of my
Sorry.
head. I've got it lurking here. Let me see. Well, 2023 it goes on till.
Oh, that's good. So they're kind of running parallel with each other. So it would be really interesting to maybe at some point sit down and identify where the crossovers are.
Yeah, where we can collaborate almost.
Yes,
Yeah,
absolutely.
yeah, that's great. The other thing I was going to say was I know Lisa's here from the King's Arms today, and I know they've been working with young people already. Is it Remind one of the courses you've been doing, Lisa?
Yes, that's the anxiety support program.
Right, so presumably do you get funding for these?
Yes, it's part of our operational funding. We take our usual approach to after school, or we call it targeted work, where we have a focus, and that's the course we're choosing to run now. Yes.
Because it's been a very strange time for children and young people, really strange, not being in school. Quite scary for a lot of them, especially if they come from a home that isn't, shall I say, very well organised or slightly dysfunctional. They've been away from all sorts of influences, which I think's caused all sorts of problems.
Yeah. In fact, along those lines, end of next week on Thursday and Friday, make sure I get the dates right. Sorry, is it 25th, 26th? Yes.
Thursday, Friday,
we still have 2 places available in a free facilitators training course. So it is for people out of East Hampshire, which covers this group, who work with young people. That's the minimum requirement. Could be school, could be youth worker through church, community, sport, whatever. It's 9:15 to 12:30, both mornings, free. You will be trained in the Remind program developed by Ralph Buckingham and the King's Arms. If you just Google Remind, you can see more about it. We have been offering, this is the 3rd or 4th facilitators training, and we're filling the last 2 spots. It's online Zoom. 8 people is the ideal, and I took it myself 2 sessions ago, and it's outstanding. And it will help prepare a body of people who work with children and young people to support the expected explosion of mental health challenges that it's been developing, but now that the young people are back in school and in contact with adults and professionals outside their homes, we expect the reporting and the identification to not reporting in a safeguarding way necessarily, but just the identification of young people struggling with anxiety to skyrocket. So we're using some grant money through Big Lottery to train up professionals and youth workers and people who work with young people. So my email address, I'll put it in the chat, but contact me. Obviously, we want to finish filling those spots. So forgive the shameless plug, but it's free. It's worth about £200, but we're offering it for free.
And it's so important.
Yeah.
Our young people are the future, and if we don't look after them now, we'll pay for it later.
Yep.
I think what we might, I mean, it's a suggestion, and we will be guided by what people are looking for. But I think maybe focusing on mental health services and what's out there may be actually a good theme for the next meeting, because by then, hopefully, all restrictions will have eased, and the next meeting's at the 7th of July. So, it may be a really good opportunity to focus on what there is to help people transition, from where they are and into the recovery.
The other thing that I've had personal experience of this year is people having babies during lockdown, and the lack of support of young mums who could normally go out and have a coffee morning with other young mums, or, they can't even, the midwives can't visit, the health visitors can't visit. And I know a lot of young mums have found it incredibly difficult this year, coping, well, a lot of them for the first time with a new baby and in lockdown, and not always having the accommodation that allows them to go sit out in the sunshine. I just wonder if we could look at something along those lines as well, not leaving sort of postnatal depression side of things.
Yes, I think that it certainly could come under, if you're looking at what people's well-being, emotional well-being and mental health. We can, that from my perspective, I think would be a really good move forward. But we'll certainly take into account what people are actually looking for, and you know, what people would like to see the next meeting cover. Does anybody else have any ideas of what they would like at the next meeting, or any questions for anybody else?
Yes, hi Janie. I don't know if you can see, I think is it Janie speaking? I've got my hands up there. So I just wanted to say that, so I'm Paula, so it wasn't Janie speaking then. I'm Paula Langley, I'm a ward councillor for district, but I'm also a coordinator for mutual aid. And obviously we've been working with people who are isolating and delivering shopping, doing pharmacy pickups, etc. And that is still ongoing, believe it or not. And I think there are people that we're working with that probably, you know, will need that kind of support in an ongoing way, even when it's not COVID, but also people that could probably get out, but are struggling again with the anxiety of it, having not been out for some time. So we're open to any kind of discussion outside of this meeting or in the meeting or offline with anybody that thinks that we can offer advice, or they could offer advice, or what we could be doing to work with these people, because we're volunteers, we're not medical experts, we're not health experts, you know, we have a feel for the people we're working with, but how do we get them back out and in supermarkets and not anxious and not worried? That's something that would be really good if people have got ideas. You're probably all very much better equipped to deal with it than me, so advice welcome, I guess.
Oh.
You're on mute.
Sorry. Thank you very much for that. I was just going to say, I can't see any other hands up. So, oh yeah, I can now, yes. Penny Woods.
Thanks, Jackie. Let me just put my hand down before I forget. I was just going to pick up on the point that I think Pam made just now about the young mums. We've been working with GPs in Test Valley and working with the NCT to link up with their walk programme. So I've just helped support a couple of new sort of walk and talk projects to get started that are giving young mums the opportunity to meet other people in a similar position, look to help with their sort of physical and mental well-being. So I think that was just a point to respond to Pam.
Thanks for that, because I know Home Start have had difficulties supporting families as well during the lockdown. They can't send their volunteers in the way they would normally.
So yeah, so just trying to adapt. And just one of the things that might be worth maybe circulating with the minutes is the project that Ross mentioned that we've linked up with, as we're partnering with Sport England on a lottery-funded COVID relief programme, looking to respond to challenges presented by the pandemic, but looking at getting people, different ways of getting people active. So I can send around some information on that to circulate more widely to those present. I think that would be helpful if that's possible.
Great, thanks very much, Penny. Well, I think we've got time for one more person. Laura?
Hi, yeah, so I'm the local social prescriber that's linked to the A31, so I belong to all four of the practices. If any of you have got sort of concerns of specific areas that you're looking at needing support with getting people back into the community, that's one of the projects that me and Natalie are going to be looking at what areas need the support. So if anyone wants to drop me a message and give me details of which sort of areas and environments of people they've got that we could work with, please do, and we can take a look at sort of who needs our support most at each stage.
We have a PPG meeting at Chawton tomorrow, Laura, so I'll probably flag it up.
Is that the one at 1 o'clock or something around that time?
I thought it was in the morning at 10 o'clock. Nikki's supposed to be sending the link out, but she's not done it yet.
Oh, okay. I haven't been sent that link, but I may ask to join.
Oh, please do. Absolutely. That'd be really good.
Fantastic. Thank you.
Well, if you give her a nudge, it might remind her to send the link out.
Absolutely.
Okay, thanks very much. Well, thank you very much. I think that's been a really interesting meeting, and for me, it's my first one with this group. I think it's been really helpful, and it's really useful for people to know where we have got to a year on. The next meeting, as I said, will be on the 7th of July. If people have any ideas about what they they would like covered, we can have a look and as I say, theme the meeting. If you've got anyone who would like to or you think would be really good to talk, then again, please, if you let us know, we will be able to arrange people to have a slot. And then the following meeting, as I say, we'd be looking to have as hopefully a face-to-face meeting, which will be for a longer period. So with that in mind, I want to say thanks very much to everyone for coming. Well, hopefully see you before July, but see you in July. Thank you.
Thanks,
Thank you.